My name is Kate and I am 38 years old. I was diagnosed with breast cancer when I was 31. I found out the day before Thanksgiving. So I had had a tough year at that point, and my mom had just passed away from cancer. However, it was not breast. That was about 9 months prior to me being diagnosed. I found the lump on a Sunday. I was getting ready to take my kids to the circus, and it was really strange because I didn't notice it the day before. It was like it had popped up out of nowhere, and it seemed really large. It didn't hurt, it just felt really hard. I was immediately concerned, so I reached out to two of my sister-in-laws who both happened to be nurse practitioners. Their names are Jen and Lori. And we made a plan that after I went to the circus, my sister-in-law Jen would do an exam for me. So that night I went over there. She did do an exam, and she called Lori immediately and said that I needed to get in for a mammogram right away. They were able to get me in the first thing Monday morning for a mammogram appointment. And it was then decided at that visit that I would also need a guided biopsy. I went back the next day for the biopsy, and I just had this really strange feeling. I was nervous, but I felt calm. I just felt like I knew though that the outcome wasn't going to be good. A couple days later, it was the day before Thanksgiving, they called me to tell me that I definitely had breast cancer. It was invasive ductal carcinoma, and they believed it to be a type called triple negative. Triple negative is a very aggressive type of cancer. It's called triple negative because it lacks any hormones, so no estrogen or progesterone, and it also lacks the HER2 protein. It can be a harder cancer to treat because there are no targeted hormone therapies. I cried, I was terrified, and then I felt like I needed to make a plan. I called Jen and Lori right away, who had already had me set up to meet with a surgeon who specializes in breast cancer. I met with him, and we also met with a plastic surgeon to start getting our plan in place. I knew I needed to find an oncologist as well. I met with my team, and it was decided that I would have a double mastectomy and undergo 6 months of chemotherapy. So at the time of the surgery, they were going to place, they're called tissue expanders, because once they remove all of your breast tissue during a mastectomy, to have a reconstruction done, you actually need the skin and the tissue stretched back out to accommodate for the implant process. This was a lot to take in. I had 2 weeks to decide because that's when they wanted to do my surgery. I did manage to get myself in for a second opinion at Rush University, where it was confirmed the treatment plan that I had in place with my local doctors was the right choice for the aggressiveness of my cancer. Just before my surgery happened, my brother and sister-in-law Jen asked me to move in with them so they could help care for me after my surgery and going through chemo. I graciously accepted that offer because I knew everything was going to be really hard on me. There was good news though. After I had my surgery, they did find out that my margins were clear and that I did not need to have radiation. So when your margins are clear, that means that the tumor is not touching any other surrounding tissue on your chest wall. So that was great news for me, considering the size of my tumor and how aggressive the cancer was. It was like a small victory. After the surgery, I was in a tremendous amount of pain. I couldn't even lift up my arms to brush my hair, wash my hair. So again, I was really grateful that my brother and sister-in-law had me move in with them because they gave me a lot of help. It took about 6 weeks to heal from that surgery and to get me healthy enough from that to start my chemo treatment. The chemo was going to consist of 4 rounds of dense dose AC. and then 12 weekly rounds of Taxol. The chemo was also tremendously hard. It made me incredibly sick. I was nauseated, I suffered migraines, I lost all of my hair, which was really hard on me. And then to top it all off, I also had to go in the day after my chemo infusions and get a type of shot called Neulasta. What that does is that actually triggers your bone marrow to start producing white blood cells. Because when you're going through chemo, it not just attacks the cancer, it attacks all of the good things happening in your body as well. And when you have no white blood cells, you can't fight infections. So that shot was absolutely horrible. It made me feel like every nerve in my body was on fire. My skin hurt to the touch, and it was just generally a miserable time. Not everybody has that type of reaction to chemo and shots. I have friends that have gone through similar ordeals that I've made after my treatment, and some had similar experiences to me. Some were lucky and they had minimal side effects. It just affects every person differently. I was actually a little bit surprised considering I was only 31 years old. I had assumed the chemo would be easier on me because I was younger, but again, that was just not the case for me in particular. I did talk to my oncologist about it, and she actually did say that sometimes chemo can be harder on younger patients than it is in some of the older ones. They're not exactly sure why, but again, it just kind of boils down to how every person handles things differently. Aside from the aches and pains of chemo, I also suffered brain fog, neuropathy, which is when you lose feeling in your fingertips and in your feet. That wasn't as bad as some of my other side effects, but it is annoying all at the same time. It was a really long, hard 6 months to get through that. And even with those shots that I was talking about before to help jump my bone marrow back into gear, I still struggled weekly with my blood counts, and at one point had such a terrible infection I wound myself up in the hospital for a lovely week-long vacation. It was definitely one of my lower points. I was feeling really sad and just kind of like, why me? But I tried to snap out of it as quickly as I could. So I'm really close with my family, and I have some amazing friends. I did keep my diagnosis a little more on the private side. I chose not to post about it on social media, but a lot of my friends and my close family friends, along with my family, all knew what I was going through. I also knew that I had to stay positive for my kids. I wanted them to know that you could get through this, you can fight anything, and that sometimes you just have to look for the bright side in things. I also knew that I needed to keep my fight going and be strong because my mom couldn't, and I didn't want to let my family down and have them watch another family member be beat by this awful disease. I participated in a fundraiser for a breast cancer charity, and all of my friends and family supported me. I was one of the top fundraisers that year, and even though just walking 3 miles at that time was excruciatingly hard, I was so proud of myself for what I did. Early detection is everything. I know that it does get talked about, but many people maybe don't realize how many younger and younger men and women are being diagnosed with breast cancer. Typical cancer screenings like mammograms don't start until your 40s. I was 31 years old. If I hadn't found that lump when I found it, if it had been a couple of more weeks, a month even, and I found my lump by accident, I probably would have had a really different outcome to what happened to me. So I'm incredibly grateful that I found it. And again, it was by chance. So never think you're too young to start checking and learn how to do your own self-exams. Also, never forget you're your own #1 advocate. If you think something is wrong, if you feel like something is wrong or it just doesn't feel right, don't be afraid to speak up. You have to fight for yourself. That's the only way people are going to take you seriously, and it might save your life. Another thing, breast cancer is really hard. It's psychological, it's terrifying. Every cough, sneeze, ache, pain, sore throat for a long time can have you wondering, is the cancer coming back? Is it in my lungs? Is it in my bones? This headache, is it a headache or is it a tumor? It gets better the longer you've been a survivor. It does become easier, but those first few years are really, really tough on your psyche. But just, again, try to remain positive and reach out to your doctors, talk to them. They know what it's like to go through that. My other advice would be to people going through breast cancer treatment would be to reach out to other people going through treatment and similar experiences as you. You might find out that you're not as alone as you might feel at times, and other survivors and breast cancer warriors know what it's like when you have a headache and you automatically begin to worry, is it a tumor? You can make great friends that way, and you'll be forever bonded by a shared experience. There are actually 4 different types of breast cancer. It's not just one cancer of the breast. I never knew that. And then those 4 different types actually have subtypes. I also learned that breast cancer gets a lot of publicity, so many people falsely believe that it's a quote-unquote good cancer to get, and I have actually had people say that to me. I know they mean well, and it's not to be harmful or hurtful, but nobody when they have cancer wants to hear that it's the good cancer to get. When you have breast cancer and it becomes metastatic, this is also something I learned. It's when it travels outside the breast and it attacks other organs. So common places for breast cancer to travel are the brain, the liver, and bones. When they travel to those areas, it's not considered bone cancer or liver cancer. It is still breast cancer. It's just called breast cancer of the liver. There are not a lot of treatment options when you have metastatic cancer. However, there are some, but there is no cure. I think it's really important that if people want to support breast cancer charities, that they should do their research. There are many charities out there that are close to home, and they do things to help local survivors, such as arranging for rides to and from treatment, making sure women who are uninsured or underinsured have the option to still get treatment and pay for things like that. There are things that set up meal trains for when they're too sick and too tired to cook. So just don't forget to always do your research, and sometimes it's best to just donate your money locally.